Hi, my name is Carrie Tackett. I am a sophomore here at Northern Kentucky University, and the topic I want to speak to you all about tonight is eating disorders and cognitive behavioral therapy. To understand eating disorders, I believe we must first know the definition. Merriam-Webster defines eating disorders as any of several psychological disorders characterized by serious disturbances of eating behavior. Eating disorders affect nearly 30 million people in the United States. 20 million of those are women, where 10 million are men. Most of those diagnosed are between the ages of 12 and 25 years of age. There are many types of eating disorders. Some of the ones I learned about in my research are anorexia nervosa, binge eating disorder, and bulimia nervosa. That's the three most common. Eating disorder NOS are not otherwise specified. Night eating syndrome, avoidant restrictive food intake, and PICA, the eating and ingesting of items that are non-food items. Signs and symptoms of eating disorders. Some of the things you need to look out in your loved ones or yourself are constantly adhering to strict diets regardless of weight, having a very unhealthy preoccupation with body image, hoarding large amounts of food, exercising compulsively, withdrawing from loved ones, refusing to eat, hiding food or food wrappers, eating in secret, eating to the point of self-discomfort, or self-induced vomiting. There are many harmful side effects of eating disorders, and some of the ones that really take a toll on your body are listed here. It's such as on your brain and on your nerves. You can get very nervous, suffer from depression. Your hair thins and your nails thin and get brittle. Your heart, you can have low blood pressure, slowing heart rate, heart failure even in worst cases, blood problems, kidney failure. The list goes on. It's really hard on your body to have an eating disorder. It sounds real serious, but all is not lost. Eating disorders are treatable, and treatment options for eating disorders range from psychological counseling with family-based therapy, cognitive behavioral therapy, and group cognitive behavioral therapy, nutrition education, where a registered dietitian will help those affected understand their problem and better help develop a plan to maintain those healthy eating habits. And medications can be used. It's not to cure the eating disorder, but they can help those affected follow the treatment plan. Medications such as antidepressants are the most common in treating eating disorders. Cognitive behavioral therapy is the topic that the treatment topic that I thought most interesting. As defined by Ben Martin, as CBT is a short-term, goal-oriented psychotherapy treatment that takes a hand-on approach to problem solving. CBT's goal is to change patterns of thinking or behavior that are behind people's difficulties, and so they change the way they feel. CBT helps individuals become more aware of their negative thoughts that they have and be able to respond to them in a more effective manner once they're thinking more clearly. There are 4 very basic steps to cognitive behavioral therapy. Those affected identify their troubling situations or conditions in their life. They become more aware of their thoughts, emotions, and beliefs in those situations. Identify their negative thoughts and accurate thinking concerning those problems, and they start to reshape those negative thoughts and inaccurate thinking to more positive thoughts. Fairburn, Cooper, and Safran stated that eating disorders and cognitive behavioral therapy are a perfect match. This is because eating disorders are essentially cognitive disorders. So if you can change the way you're thinking, you can change your life. CBTE was designed as a treatment for adults suffering with eating disorders, and it's designed to be equally suitable for men and women suffering from eating disorders. Awareness is key. The National Eating Disorders Awareness Association focuses on public understanding of eating disorders, the causes, the dangers, and the treatments. I found their website very informative on how eating disorders are formed, the awareness and how to get help and how to help others. You can check out their website. And on their website, they have a screening tool where they say 3 minutes can save a life. It just takes 3 minutes. You can answer the questions. And you can find out if you're at risk for an eating disorder and how to get help. Eating disorders have the highest morbidity rate than any other mental disorder. Early detection is key to saving the lives of those we love and ourselves.